I'd like to invite John Lewis up to lead us in a prayer and the pledge. John?
Would you please rise for the invocation and pledge of allegiance? Thank you. Let us pray. Almighty and everlasting God, we come to you this day with grateful hearts. We thank you for this time together and for this meal before us and the fellowship around these tables. We thank you for all the medical professionals in our world who sacrifice their time, their sleep, and their families so that they may bring healing to those in need. Bless them as they care for every person who walks through their doors, no matter what time of day or night, and comfort them as they come alongside those who struggle with so many challenges. We thank you for our doctors, our nurses, our hospital administrators as they seek to make our world a better place for all of us. We pray in your holy name. Amen. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, John. Appreciate that. And again, a warm welcome to everybody this afternoon. My name is Tim DeRico. I am president of the Lindenwold Kiwanis Club. And on behalf of our club and the Hamilton Rotary Club and the Hamilton Chamber of Commerce, we'd like to welcome you all today to the Red Carpet Luncheon. I'd like to invite Dan Bates, president and CEO of the Hamilton Chamber, to come up and lead us.
Thank you, Tim. Good afternoon, everyone, and welcome to the Red Carpet Luncheon on State of Health. The Chamber Red Carpet Luncheons are a partnership with Kiwanis and Rotary. I want to begin by thanking the Chamber Centennial sponsors. They are Butler Tech, Champion Health, City of Hamilton, First Financial Bank, Kettering Health Hamilton, Mercy Health Fairfield Hospital, Stiefel, the Todd Group, and U.S. Bank. I also want to thank Pawnee Water for they are our healthy hydration sponsor today, and TV Hamilton for being here to video and live stream. So thank you both as well. This program has been some time in the making. Over the past couple of years, I've had conversations with many of our healthcare providers and health departments with the desire to do an awareness of the state of the health in our community and our county. The timeliness of the most recent health and needs assessment provided current data to make this possible. It is my hope that this will begin a broad-based conversation among healthcare providers and health professionals, the business community, and residents. To get the conversation started, I want to introduce Paul Hoover, President, Kettering Health Hamilton, who will moderate today's panel discussion.
I tell you what, I'm here with such an esteemed group of folks. I would be lying if I told you I wasn't a little bit nervous. I confessed to Flora earlier that I've got such a good group of folks. And having just come through the presidential elections, I am acutely aware that we expect shenanigans from our candidates. But it is the moderators who typically get the most guff. And so if anything goes wrong today, it's on me. It's not because of our esteemed panelists here. Let me just go through and kind of frame out why we're here today. Dan, thank you so much. I want to welcome you. This is not your typical panel discussion. Get ready for some power-packed conversations about how we can all become our healthiest versions of ourselves and right here in our amazing community. Think of this as a brainstorming session and a place to start where the brightest minds in healthcare and community leaders, wellness, come together. We're diving deep into some of the challenges that are facing our community and hopefully, and it is, creating a spark that is transforming our community. By the end of the session, you'll walk away with a few practical tips, a renewed sense of hope, and a personal challenge to boot. So get ready and buckle up. So our panelists that we have here today, in no specific order, Justin Kruger, President, Mercy Fairfield Hospital. Thank you for the hand sanitizer at the table. Flu season, there we go. Stephen Roller, CEO, Primary Health Solutions. Oh, come on, nobody's going to applause for Stephen? That's awkward here. Ann Siebert, Senior Director of Hospital Operations and Nursing, TriHealth. Jackie Phillips, City of Milltown Health Commissioner. There we go. Martina Weber, this is probably the longest title of everybody here, so I'm going to see if I can get this right. Butler County Mental Health and Addiction Resource Recovery Services Board.
Yes.
Okay, and she is the Associate Executive Director. There we go. Eric Ballister, Butler County Health Commissioner. Cindy Hogg, City of Hamilton Health Commissioner. And last but not least, Aaron Day, Vice President Behavioral Health for Community Health First Solutions. All right, so at your table, you've got this brochure here. It is a very condensed summary of an over 200-page document that was just completed back in 2023. And every 5 years, our county goes through and does a health assessment. And this is kind of a summary of some of the findings in there. So today we're going to kind of go through three main things, kind of framing up what's going on in our community, really focusing on mental health and addiction, chronic disease, and then maternal and infant health. So those are the main things, and then we've really got a challenge for us today. So we've learned a lot from our health priorities in the community that mental health, addiction, chronic disease, and maternal and infant health are some of the key issues. It's great that we have this data in front of us. Can you all share, can our panelists share from their professional perspective on how we can improve productivity in our workplace and our community by addressing these top three issues? All right, somebody's got to jump in here.
I'll start.
There we go.
I would say focusing on wellness and prevention really is the key to all of it. Keeping people healthy so that they can come to work is the key. And start with hand washing.
I completely agree. We have to recognize, and I think most of us do already, that health and wellness is everything and spills over into every aspect of our life, personally, professionally, you name it. And certainly from a professional standpoint, we, our colleagues, our associates aren't able to bring their best effort forward if they're distracted or consumed otherwise with their own personal health journey. And so recognizing that and embracing that as something that's only going to be additive going forward in terms of the contributions of the organization, the community, and society makes all the difference.
So I love that. Yeah, if we are not whole ourselves, and then we can't go and help our community or our neighbor when we're not whole. So looking at the data, one thing that stands out is there's specifically a need for more education and awareness. One of the encouraging statistics is a positive trend that we've encountered in the 2023 report. I'm wondering if Eric and Jackie could talk a little bit about some of the hope that kind of came out in the study.
Yeah, so I think one of the big topics that you judge a community's health on is infant mortality, and historically in the United States, it's been one of those points of contention that in the Western world we're among the worst. But one of the upsides here that we saw as a trend over at least the last several years, and that was reflected in our report, is that infant mortality has actually gone down in Butler County. And infant mortality, for those who aren't aware of what that really encompasses, is really any child who doesn't complete 1 year of life. And we're actually below the 2030 target for that. So some good things have been happening. A lot of that is due in part to a lot of the efforts that not only health departments are doing, but hospitals, nonprofit agencies, the community at large is doing, just to make awareness, but also to provide services and resources out there for predominantly for pregnant women and children as they grow.
Thanks, Eric. And I love that Barry White voice down there for those that are old enough to know Barry White. But with infant mortality also, we can't be remiss to know that there is still a disparity, right? And so African Americans usually suffer greater with maternal, child, and health areas. But what we've been doing too is focusing on those areas and realizing that culturally speaking, people are different. But when we get into culturally speaking, everyone in the room is different, right? So healthcare is really starting to lean on treating people individually and not just coming and just rubber stamping. We're trying to look at the holistic person in front of us and really start finding out which some of your fears are or what is the way that you will make your health better. And that's what's exciting. And so we think we're seeing a better result with that as well.
Thank you, Jackie and Eric. So Stephen, I'm wondering, you do a lot of work on infant mortality, but you're actually meeting people where they're at in the community. Maybe talk a little bit about what Primary Health Solutions is doing in that front.
Yeah, thanks, Paul. So from a health center standpoint, so we're a federally qualified health center, and we work, the one thing that, I heard Eric and Jackie both say is, this is a problem, all these problems can't be solved with one organization, whether it's a hospital, whether it's a community mental health agency, whether it's a community health center like us, whether it's the health department. There has to be a strong amount of collaboration across the community. And so I think from our standpoint, we have the WIC program. And so early on, as it related to the infant mortality, there was a cross-collaborative group of folks saying, sure, breastfeeding is important. Let's make sure we're doing breastfeeding education at the hospitals, at our centers, with WIC. But it has to be a group that has shared objectives like you see here and are working together with multiple venues and multiple strategies to help the health of the community rise.
Yeah, you're absolutely right, Stephen. And if you come into one of our hospitals, the mortality rates are some of the lowest in the nation right here in our county. We are incredibly blessed. But if folks aren't accessing those services or are not getting the prenatal care resources, that's the issue. And so part of what we want you to understand is that our job here is to collectively understand and be those connectors or voices in our community. So as we think about some of the biggest opportunities that we have in the community to make a difference, what are the top 3 health priorities that you all are seeing shaking out, and how maybe are you all addressing those in your respective areas?
I just wanted to say that doing this community health assessment really it leads to a community health improvement plan. And what we found is we have gained such great partnerships in addressing this community health assessment and working together in this CHIP as we move forward. We're going to find those gaps for each of these different priority areas. And with having individuals with expertise in all of these areas and all working together to support each other, we'll be able to make a difference.
And the 3 priorities on the desk, of course, I'll just bring up November is National Diabetes Awareness, right? So I just spoke on this. 98 million people in the United States are pre-diabetic. Most of them do not know that. And so this is a time that we can start talking about that, making sure that we're going to the doctor and looking at that. We also have COPD, chronic obstructive pulmonary disease. COPD is easier. And that #1 cause is smoking, right? So we can stop smoking, encourage our loved ones, our neighbors to stop smoking and having smoking campaigns. So bringing about awareness with these different priority areas is the key as well.
Okay, love it. So it's often said genetics loads the gun, lifestyle pulls the trigger. And so there's a balance of that. And so oftentimes we can't control our genetics, but we can control maybe what we put in our mouth or what things we do in activities. So maybe taking some active steps. I love that, Jackie. So as we think about these health priorities, what gives you the most hope over the next 5 to 10 years as we see these improvements becoming a reality? So maybe Stephen, Justin, and Ann can walk us through what you all see from your vantage points that's over the next 5 to 10 years.
Yeah, I think we're at a really exciting point within healthcare, population health and wellness. And it's worth noting, I think, that hospitals and health systems going back many, many years ago, we really existed to care for the not well. It was more of a retrospective look back. You've got individuals that are coming to you because something is wrong. Now, obviously, all of our hospitals and health systems and organizations represented here today will continue to do that because that's an important need. But we're really shifting our focus and mindset to outside of the hospital. How do we keep people well? Conversely, how do we keep them out of our facilities? Not that we don't enjoy caring for them, but truly, how do we focus collectively and collaboratively on delivering population health and wellness and not just being, retroactive? And so I'm excited that there's just more awareness. I think everyone as a whole is taking far more personal responsibility. There's a tremendous amount more data, not only in terms of, what is good for you and what is not, but I would venture a guess that roughly 50% of the individuals in this room probably have an Apple Watch on, give or take. There's a tremendous amount of data and power in that for you individually. And then how do we as hospitals, health systems, physicians, you name it, tap into that and construct a plan that's specific to you to meet your needs? So I'm really, really excited about where this is headed the next 10, 15 years.
Yeah, I'd say the focus on population health is really exciting, and shifting from the fee-for-service model to really working on keeping people healthy. And I would say, don't ever underestimate the power of your annual physical with your physician. There's so many people that wait and don't have their labs done every year or their preventative screenings, and something, then they present to the hospital with something catastrophic that could have been prevented had they have seen their doctor, a year ago. So please keep that in mind as somebody coming from the bedside. That's really, really important.
I would just add to that, one of the things that gives me a lot of hope as it relates to where healthcare is going is really addressing what's called the social determinants of health. There's some world-class medical groups up at this table in the community where we live, but again, it tends to treat what's already wrong. And I saw a graph a long time ago that said you can see the best physicians, go to the best hospital systems. That drives about 10% of your health outcomes. The other 90% is things like, where do you live? What kind of transportation do you have access to? What type of education? So to look around the room and see a lot of the thought leaders, either community leaders in this room, it takes a huge group to say, what are we doing in these school systems? What are we doing in the communities? How are we developing green spaces in the community? What's affordable housing look like? All of that is driving the population health outcomes. And I think we're entering into a new phase of healthcare where in the past, the healthcare providers weren't necessarily involved in those spaces. We were just treating the results of that. And we're going to be forced, and frankly, it's exciting to be able to partner in those spaces, because if we can make sure that people have access to those other social determinants and those are addressed, health outcomes will improve.
Yeah, so there's a lot of good things on the forefront. So as we kind of frame up today, a couple of things that I want to pull out that the panel hit. So one is outpatient care, moving care outside of the hospital. So Justin touched on that. Almost 70% of the care in our community is cared for outside the four walls of a hospital. And so that's taking place. That's a good thing. It's better to get care done preventatively or proactively versus when in an acute phase. Secondly is the access to data is really key. And so when we have data like on our Apple Watch or in the community, it helps us to then frame and make decisions on those things. And then the thing that I hope you're picking up is that this is a group of folks that works together. We are constantly talking to each other. I know folks joke and, folks like, oh, Justin and Paul or Jeremiah and Paul, you guys are competitors, or, health department and, Middletown or Hamilton. No, we are constantly talking and collectively focusing on how we can work together to serve the needs in our community. I am most optimistic about that, which nobody talked about, but is really evident in our time here today. So let's now dive a little bit deeper on mental health and addiction. So data shows that many people in Ohio aren't getting access to mental health support that they need. What are some of the ways that we can break down the barriers and make it easier for people to access the help that they need? Maybe Aaron, Stephen, and Martina can help us unpack that a little bit.
Yeah, thank you. I think one of the things that first came to my mind is something that we actually experienced ourselves at Community First Solutions, and that I would challenge all of you guys as leaders in here to go back to your organizations and look at this is, mental health is what we do. And what we ended up finding out was that our opportunity and our insurance plan did not really support mental health and that access to it very well for our own staff. And so it took a situation to bring that to our attention. And so we immediately made changes and made that care more accessible for our own employees. So I would just challenge everybody in here, go back to your organizations today, take a look at what does your healthcare plan support for your own staff, and maybe make sure that it is inclusive and will support all your staff in your organization.
I love that. Thank you, Aaron.
Yeah, to piggyback off Aaron, I think it's important that we take care of our staff and make sure that they're getting the benefits that they need, but also allowing them time and flexibility to take care of whatever that is and work their schedules around that as best we can. But I also think, kind of to the greater population outside of our organizations, is there still a stigma? And how many people in our lives can we think of that may benefit from reaching out for help but don't? And that's because maybe they're scared or they're worried about what others might think. And so I think stigma is still a big problem for the mental health and addiction side of things.
And I'm going to lean in on the stigma. I think everyone in the room, I'm looking around, has a brain. And sometimes we question it, right? But mental health is about our brain's health. So whether it is substance abuse or Parkinson's, Alzheimer's, dementia, all of that is the health of our brain. And there are ways to make sure that we are treating our brains well. And so getting outside and walking and sociability, I mean, talking to people, not being alone, that's the #1 killer is when you isolate yourself. So all of that leads to that healthy brain. So while we keep fighting the stigma with abuse and a drug addiction and alcohol addiction, and wait a minute, all addictions, because somebody in the room got something, right? Shopping, gambling.
Careful.
I know, he said careful. Candy, pizza. So it's still how healthy your brain is. And so it's really important so we can get rid of that stigma. We're all going to be healthier in our mental status.
The only thing that I would add on to that, kind of what Paul was saying about the collaboration that you see in this room, in our community, it goes to kind of the integrated nature of it. In our model, we actually have brief behavioral health at the primary care setting or at the dental setting, at the eye doctor. And part of that is because one of the data points on here talks about the suicide rate. There was this statistic I saw years ago that said, it's a very high percentage. I think about 84% of everyone that attempts suicide had seen a medical provider within the week preceding the suicide attempt. And so if we're completely siloed in how we deliver the care, it lends itself to more disjointed, fragmented care and worse outcomes.
So taking a holistic view, and I hope what you're picking up is this concept, it's okay to not be okay. That's the first thing, and so it's okay to acknowledge that. Secondly, we have a responsibility to each other. This community is better because of each one of us in this room, and so look out for our teams, our families, our employees, whatever it may be, and check in on them, how they are doing as people, and then make sure that our benefits are structured in a way that allows people to access that and then get the care that they need. So let's go a little bit back in time. So adverse childhood experiences, ACEs, are a concern, but we can mitigate this impact. How can we build a resilience in our community to prevent adverse childhood events and support those who have been affected? So that we've got, Erin, Jackie, and Cindy, maybe tell us how we can do that.
Yeah, I know Martina and Jackie, I think I'll speak a little more to this, but I think one of the big things is any way that we can provide those supportive services to parents and families and youth and really meet them where they are at, whether that's in their home or in their community or in their school, I think is going to be one of our biggest challenges, but can really make a big impact.
Here's where my true passion lies, is with our youth, because I feel like we tell them a lot of really good things and we don't always back them up, especially when we see a youth is struggling, or more importantly, when we don't see a youth struggling. The kid that sits in the back, that doesn't make a lot of noise, that doesn't have a lot of disruption, oftentimes are the ones that need the help the most. And they oftentimes get forgotten. So some of the things at the board that we support are some programs through Envision Partnerships. One of those is called Camp Mariposa, and this is a camp. It's a weekend camp. You stay the weekend, Friday through Sunday, and it's for youth ages 9 to 12, and then there's a teen camp, 13 to 17, and it's designed for kids who are impacted by substance use, who have home lives that are not super healthy for them to be in. So they learn more ways to take care of themselves. They learn that they can't control what's going on in their home. They can't stop what's going on in their home, but they can live full and well lives. So that's just one of the programs that we've targeted kids who have a high ACE score.
Before I give this to Cindy, I always try to bring all of this back to us. Kids always grow up to be adults. So that's who we're going to be working with, hiring, etc. If you do an ACE score test with your employees, I guarantee you they've been traumatized and they'll have high scores, and you'll know that that's why they're late, or they fly off the handle easier, or they're sick a lot, etc. So,
I just wanted to make another comment. Another aspect of keeping our children safe and mental health condition in a good place is making sure that our kids have fun and safe places to be and to go, which includes supporting our youth groups like the Boys and Girls Clubs, our community centers. They need a place to be where they can just be kids and get away from maybe some of the stresses that are going on at home. So it is important to remember that we need those places too, and we need to support them.
It's a good reminder. Our kids, all of our hopes and dreams are tied up in our kids, and I'm incredibly optimistic. The YMCA and Vision Partnerships and all of the work that's happening, there's a ton of emphasis and investment that's taking place. So what are some of the effective strategies for promoting positive mental health in both the workplace and in our community?
I would start just by saying acknowledging, kind of it's already been touched on, but acknowledge the fact that mental health is just as important as physical health. Be there for your team and engage them as part of the process. I mean, obviously have the resources and trainings available, but just be there as a beacon of support, and that's really boils down to our organizational and community cultures, respectively. But be a part of that and engage them in that process to solicit ideas and thoughts. I mean, because the last thing they need is the hospital administrator to come down and say, hey, I know how we're going to tackle the mental health problem we have amongst our team. Because I don't know, but there's probably a tremendous amount of really good ideas and thought and energies that they could be a part of that solution and help culturally to spread that. So that would be my push.
you guys, you know I can talk all the time, but
That's part of why we invited you, Jackie.
I know, right?
Yeah.
Paul? But you know, mental health, we keep saying mental health, and I guarantee you our mind is still going like Martina said. We go over to that stigma of mental health. But mental health just means your kids are sad today, or they're depressed, or they're struggling, or they're anxious. And all of those emotions is about the way we're looking at things and thinking about things. Don't be afraid to address them. Don't be afraid to talk to them and try to work it out. Don't be afraid not to answer. So you're feeling kind of sad? Yeah, that sucks. Just acknowledge the feelings and teaching them how to kind of work through it and realizing that we should do that with each other. So many agencies go home and they think they're getting away from it, and at home they're dealing with the same things. So we have to realize it's always an us. It's our neighbors, our kids, etc. And so just know where you can reach out and acknowledge everybody may be struggling and not okay today. Right.
Yeah, I had a colleague I was meeting with on Monday, and I said, hey, how was your weekend? And he said, it was pretty crappy. And I said, do you want to talk about it? And he goes, no. But I said, I appreciate you telling me and just being honest with where you're at and how things are going. And sometimes it's just simply as acknowledging to each other, just like I told Jackie, I'm nervous to be up here speaking in front of all y'all. And Jackie said she'll make sure I do okay. But sometimes it's just acknowledging that and then moving forward and just being honest with each other. So how can we better integrate mental health and addiction services into the primary care setting to improve access, outcomes, and overall wellness? Maybe Aaron, Stephen, and Ann.
Yeah. Stephen maybe touched a little bit on this, with having the integrated, behavioral health clinicians within Primary Health Solutions. And I think that's one of the key things is, they're probably one of the very few that do a good job of that. And so how do we educate other primary care providers to integrate this, as a part of their processes? And not just for adults, but even pediatricians. I will tell you, I was a little excited when I took my 8-year-old for his well check visit about 2 months ago, because they had a screening tool on depression and anxiety that they actually gave him. And so I was a little excited about that. But I think it's, any chance that we can work with those providers to help them with that, here's how you screen, you can refer to us. And then I think we've said it a couple of times up here, but how we collaborate with each other. Primary care can only do so much. So once they've started that process, how do they use us for that, extra assistance?
Yeah, just to add to what Aaron just said, I think meeting people where they're at, trying to remove as many barriers as possible. The healthcare system is very hard to navigate, and oftentimes we're some of the worst at making that harder. And so trying to remove as many barriers as possible, and then we've said it multiple times, removing the stigma, right? If you're doing those screeners on a regular basis, it becomes part of your visit. just like you get your blood pressure checked and you get your height and your weight, you're like, somebody's going to ask me about my anxiety, my depression, how many drinks I'm taking, all of those things. And that starts to normalize it a little bit to where people are more comfortable saying, you know what, maybe I do have a problem. And then we can get them to the community resources that best suit those needs.
Lastly, I would say that you're your own advocate, right? So if something's going on and you go to your annual physical and the doctor doesn't ask you about it, you need to speak up. It would be great, I know it's great they do that with the children, but I don't think that I've heard a primary care doctor ask somebody about their mental health when they go in for their annual visit. So never forget that you should be your own health advocate and speak up if something's going on. And one other thing I'd just like to put in there when we talk about the stigma of mental health, it's a chemical imbalance in somebody's brain, right? It's not anything you did wrong. It's not your fault. It's how your brain is made up, right? So get help. There's medications out there. There's therapy. There's things to do to help people.
Yeah, this is not a life-ending diagnosis. This is not something, and we all go through highs and lows as people. And so incorporating this into our overall personal check when we say, how am I feeling today? When someone asks us, think through how we're feeling today. Secondly, incorporating it into our overall care. And then thirdly, simply talking about it and then normalizing those sorts of behaviors is where we can be. So now let's dive into the second aspect that our community health plan or community health survey looked at, which is chronic disease. So we know that lifestyle choices can make a big impact on chronic disease. How can we empower individuals to take control of their health and prevent conditions such as heart disease, diabetes, COPD, and especially amongst our youth? So maybe Justin and Ann can talk a little bit about what's happening in the healthcare space.
Yeah, I mean, obviously you have to educate people. I mean, it's one thing to go out there and say you should eat right, you should exercise. I think by and large most people know that. What we do a pretty poor job of, I think collectively, is connecting it to the why. Why is it important that you eat right? Why is it important that you exercise? And Stephen touched on social determinants of health, and we could have an entirely separate discussion on how important those are in each and every daily interaction we have with our respective patients. But it's one thing to tell them, to eat correctly, but if they don't know how to prepare the food or don't have the cooking utensils at home in order to do so appropriately, that's an incomplete message. And so we just need to be cognizant of, connecting it back to the why this is important, and then embracing those things. And it's one thing to sit up here at the panel or within our own organization and say, this is important, we're going to be committed to this at our facility. But if you don't truly incentivize that and engage that and model that behavior, quite honestly, you're not really putting your money where your mouth is, so to speak. And so that involves making significant investments on the part of the employer to encourage and promote healthy wellness habits and behaviors amongst the team, whether that's, partially incentivizing gym or fitness center memberships, investing in stand-up desks, allowing individuals on their, lunch breaks to go or on a walking trail around the campus, whatever that may be. But again, modeling that appropriate behavior and connecting it to the why, because ultimately, going back to the very first question, if we're able to do that successfully, not only will that empower the workforce and make them overall healthier, that'll also lower their health insurance premiums and the cost of care as employers and owners of respective businesses. So there's a tremendous amount of downstream positive behaviors or results as a consequence of those behaviors.
Thanks. And I like to put things pretty simplistically. So you're either going to manage your health or you're going to manage your sickness. So you have to choose which one you're going to do, right? Think of food as medicine. Everything that you put into your mouth, look at the chemicals, look at the packaging. What are you putting in your body as fuel? And think of it, the right diet, the right combination of food can be as powerful as medications.
I love that. You don't have to be perfect, but we can focus on being a little bit better just by focusing. So food insecurity, it's a real thing. It's a challenge, but we can overcome it. What are some of the innovative ways that we can partner to improve access to nutritious food for those in need and promote healthy eating habits at the same time? Eric and Cindy?
I wanted to speak a little bit about, we all know that there's food insecurities in different areas of our county. What we're doing in Hamilton, we are partnering with Jeff Grambell at Serve City and Envision Partnerships, and we are actually conducting a food assessment survey for the city of Hamilton. There is a flyer on your table. If you take a look at that, or if you want to take it back and promote that, that would be wonderful. So as we learn information through that survey, which referring back to some of the questions relate to, do you know how to cook? Do you have cooking utensils? Those kinds of things. So as we learn those gaps, we'll be able to share with our partners, and then we can start making change happen.
You know, I think in our communities, we have a lot of things that are already in place that we can emulate and model. So you look at schools, you know, they have a lot of breakfast programs. You know, again, this is perhaps an investment in your business or into, some facet of your business. But, you know, taking care of your employees, taking care of your staff, in some cases taking care of your clients and the people that you are selling or serving to, goes into part in making that community healthier. So perhaps, making breakfast available to your staff. I know that's an expense, but, the healthier they are, the less sick days, the more productivity. And, you can apply it to mental health as well. So again, I think, there's a lot of things that are working. Let's take a look at some of those and then think a little bit creatively how we can implement them in our business as it stands today.
All right. So thinking about technology, how can technology help people manage their chronic diseases, make healthier choices, and live more fulfilling lives? Maybe Stephen, Justin, and Ann can talk about some of the ways technology is coming into helping us make better choices.
I think Justin mentioned, wearables is a big way. A lot of people are getting access to Fitbits, Apple Watches, Google Watches. But that is just a very small kind of tool. One of the bigger things that it's identified here in the health improvement plan is health literacy. Because if someone wears that Fitbit and they're like, well, what does this mean? And they don't know that this blood pressure is really high, I need to do something about it, they're going to end up in one of the emergency departments having a stroke, having a heart attack, and not addressing it early. So the technology can help with early intervention, but I think there's also some opportunities to use technology for improving health literacy in the community and also addressing some of those social determinants of health, talking about the food insecurity. If someone lives in the middle of a food desert, you or I might be able to say, hey, I'm going to Instacart, or I'm going to have healthy fruits and vegetables and healthy foods delivered to my home. That's not an opportunity for everyone, and transportation is a huge barrier for many of the patients that we see. So if we say to them, hey, you need to have this healthy diet, to get in the car and go to Kroger or Aldi or Jungle Gyms just isn't always an option for everyone. And so using the technology to address and overcome those barriers is key.
Can I say too, real quick, before you get in there, understand that just because you can get to Aldi and Kroger's does not mean you can afford the food that's there. So sometimes our produce is very expensive. So we also teach how to get fruit, vegetables, and freeze them. Do not waste them. How many times do they go bad on you or whatever? Just because you freeze them, they don't look as good, but they still work as well in your stews and in your banana bread or whatever. I know, it's not really a good choice.
Fruit smoothie, Cindy.
I made the choice, Paul, not to eat my butter because the roll was good. But we have to remember, too, that sometimes people do not have that when they have opportunities and transportation, they can't afford it. So how can you get around that way, too? And how can you make canned things better for you? It's still a better choice.
Yeah, the only thing I would add, and we talked a lot about the wearables, and that data is going to be great once we really begin to mine that as an industry and give people more appropriate, personalized recommendations. But the other thing from a technology standpoint, and we really, I think, collectively saw this during COVID too, is the explosion of telemedicine. And we always had telemedicine. And for us, we're very fortunate to live, work, play in an area that has tremendous hospitals and health systems wherever you go. And I personally have been in other markets across the country that hasn't always been the case. And so we're very fortunate in that regard, but there may be an individual who resides 2-3 hours from here that maybe doesn't have a hospital within an hour's drive. And so with the advent and really full adoption of telemedicine, we're able to have virtual ICUs that may be being monitored remotely by individuals from any of our institutions to provide that level of care that's physically hours away. And for those individuals that can't drive 2-3 hours or transportation problems and just trying to get to their physician, well, we're doing virtual telemedicine visits. And it's not perfect for everything, but it's certainly a nice tool to have in the tool belt.
Just quickly before we move on, I wanted to add for managing chronic disease, as Jackie mentioned, November is the Diabetes Awareness Month. And my mom has diabetes, and she also has Parkinson's disease. So taking blood sticks are impossible for her because she has tremors. So she has a Dexcom. And if it weren't for the Dexcom, she would be in a horrible place. So just those technologies are life-changing for folks who really need them.
Yeah, those technologies that are there, they're there to be used, but they are simply data and information. And at the end of the day, again, we've got to look out for each other, encourage that behavior, model that behavior, and then make sure that we are advocating and providing access for those who don't have access to those things. Let's focus on maternal and infant health now. Our data highlights the disparities in mental health and infant health outcomes, but we can create a more equitable system. What actions are we taking to ensure that all mothers and babies have access to the best possible start to life? So maybe Cindy and Jackie and Eric can talk about what's happening in our communities here.
Sure. So, at the county health department, we've been fortunate enough to have a group in our health promotion sector that focuses on Black infant mortality. They started a chapter of Queens Village, which has several chapters across the country, Cincinnati probably being one of the more bigger ones, but we've had a lot of success there in bringing resources and really that preventative education, outreach, and community to women in need in a particular community. And as a result, it's grown quite substantially over the last 2 years, and I think it's one of those things where, again, if you bring a resource to people, they will come to it. It's really about getting the word out, getting the education out, and then getting them in that continuum of care, not only with us at the health departments, but with the hospitals, the FQHCs, the mental health resources, really just getting them integrated in everything that we have here in Butler County.
And mamas need to be healthy, right? So women need to begin their start before they even get pregnant in a healthy state. And then they take on that baby. And it's a lot of things that go on. Your mental health issues, your stressors, your work, everything while you're in that state at 9 months. We want to get that baby full term because most of our babies that we see with infant mortality and issues are premature babies. And that costs a lot of money as well, a lot of interventions there as well. So again, that community, and if I can't say anything else, community is very important. People will come to you and say, my doctor said to take this, but what should I? That's because they trust you and maybe not trust you, the doctor, as much as you. Community is very important. The answer to that question is, do what your doctor told you to do. That's what I always say. But you have to make sure that they know that they have a trusted source that's going to direct them back to the correct source.
That's a good point.
Community, very important.
Community is very important. So prenatal care and breastfeeding have immense benefits, both to mom and to baby. How can we better support expectant and new mothers in making these healthy choices, both for themselves and for their infants? Maybe Ann and Stephen can talk about some of the work that you all are doing.
Sure, I think it starts with prenatal education, presented in a way that can be understood by the individual. So we have to look at people and meet them where they are when we're doing this. Also with high-risk pregnancies and moms, having some type of navigator to help them work through the system, because there are a lot of resources out there, but finding them, tapping into them, accessing them, getting transportation, all of the things can be in the way of that. So that's really important, having somebody to help them connect the dots and follow up with their care.
I would just add to that, again, just more resources, right? Community-based resources. There are like breastfeeding support groups where they go and kind of talk through some of the challenges that they have. Oftentimes when any mother, especially young mothers that want to breastfeed their babies, they run into issues. It's the middle of the night, and being able to call someone to say, I'm having a problem, how do I get this, how do I correct this? Having someone they can call. Through the WIC department, they have a lactation consultant on call 24/7. But it's education. So much of it is education, creating the community, and showing the data of why it leads to better outcomes for both mom and baby.
So transportation, we've got a partnership with Envision Partnerships. They help transport folks to and from doctor's visits. We've got 24/7, you can call somebody, but a lot of times it's simply connecting people, and so that's where we all come in. We're all gonna get a phone call or a text, or we'll see some Facebook post or TikTok or whatever from a loved one, and so that's where we have an opportunity to check in on them. So how can we strengthen communication and collaboration between the healthcare providers in the maternal and infant care to ensure the best possible outcomes? So maybe Justin and Stephen talk about some of the work that you all are doing.
I think at the root of it, it boils down to partnership, transparency, communication, and aligned goals. I mean, this is, and Paul is right, this is a 3 or 4 page document you have in front of you, but it is literally distilled from 200 pages that took many months and teams of people to create. And so we, as individuals representing our respective organizations, are all aligned and collaborating, not just today, but really throughout the year and for the past several years, many years, to focus on how we collectively impact for the better the health and well-being of the community. And so I think that is rooted in partnership, and there are certain things that Mercy's not going to do that maybe other health systems might, or I can't tell you how many times I picked up the phone and called Stephen personally saying, hey, I want to pick your brain on something. I think this is going to be good for our community, and we'll go back and forth. So I think just us maintaining that collaborative nature and posture that we've had, and I think was really boldened coming out of COVID, that's been a great thing for our community.
Yeah, just building off what Justin said, you know, I think knowing that this is a county-wide assessment, also within the county are a bunch of little villages and cities, and the approach that we're going to do in Hamilton's inner core versus what we're doing in Oxford or Monroe needs to be individualized and tweaked for that community. And that's why we have to rely on partnerships, because one entity, one type of delivery system isn't going to meet the needs of all the unique populations within Butler County.
Thank you, Stephen. So we're going to land this plane here, I promise. I told Dan I'd make sure I didn't embarrass the family, so we'll keep us on time. So let's focus on some of the things that we can do to take action. So we're all leaders. In case you don't know, you're a leader. Okay, just everyone nod their heads for a second. Dan said, they're not everyone's leaders. There we go. Thank you. Yeah, we're all leaders. Your family, your kids, your church group, your civic group, your volunteer group, your YMCA spin class, you're all leaders. So we'll start there. So for the panelists, we're going to break this down. We're going to get real. So imagine we're talking to our teenagers. Okay, we want them to do something. How are we going to get us and our teenagers excited about taking some healthy habits and incorporating those into our lives? Maybe Martina and Aaron can talk about some ways that you all are seeing that take place.
Sure, I happen to have a pre-adolescent child, so this is very relevant to my life. I think ways to explaining is going back to the why. Why do we eat healthy? And I have to talk to her often about why we are choosing healthy options. Because if any of you know any pre-adolescents, they don't eat very healthy. So, you know, talking about that, getting involved in sports, finding things that she's interested in. I have another younger child who's not super interested in sports, so we find other activities, clubs, things that she can get excited about. Sometimes we like to go hiking. So just really talking to our children, teenager or otherwise, about what they like to do and giving them the why of why we do this. Why do we get out and walk our dog? And why do we go to the gym? And why do we eat healthy foods? And really explaining that to them, I think, helps.
Yeah, I'll piggyback off that a little bit, Martina. I have a 14-year-old freshman, and so I will say it's what motivates him, you know, what motivates that teen, what are they interested in? So if I can relate it to football, we're good. You know, if I'm talking about how we can read this really interesting book right here on this biography, no, not gonna work. So, you know, I would say to anyone talking to a teenager, you gotta have a little bit of a conversation to figure out what makes them tick, what are they motivated about, what interests them, and then try and relate it back to that item.
So make it fun, find your why, and get some access to data. And then here's one thing I'll tell you. The journey is always better when you go with someone with you. Invite somebody to go play pickleball, football. Mike Brammer and I, we did the Healthy Hamilton Happy Hour. It just ended up being me and a couple of folks. We'd go for a run up and down the trail. It's always better when you're with each other. So as we wrap up here today, what I want you to take away is we've got an immense group in Butler County of amazing health leaders that are working on behalf of needs in the community. We all have a different perspective, vantage point, but at the end of the day, we are focused on serving the needs of our community. So this is not the end, this is really the beginning. So as you all see gaps or you identify ways in which we can better serve our community, please connect with one of the folks up here. We are a resource for you. And then lastly, what I will say is it's about us collectively taking action. And so, Dan, I think we've got at the table, we've got some cards. Is that right? Yeah. So you want to wave for folks what they know what they're looking for, the card? An envelope. An envelope. Yes. All right, so there's a card. I want you all to get that out here. There we go. There's one, see, that's what they look like here. There's some pens. So we've got cards and pens at the table. I'd like for you to take about 30 seconds and write down one specific thing that you are going to do over the next 30 days. This could be to improve your health, to improve your mental health, to improve a relationship. We're going to mail this back to you 30 days from now as a reminder. So what we're looking to do is for this to be a catalyst for us to jumpstart and to take one step in improving our health. I'm not going to monitor these. We're not going to create a study. Make sure you address the envelopes, or if you want to send one to Dan Bates, you can put his address as well.
And Paul, it could be what you're not going to do.
Yep.
Like you may not have that third glass of wine. Or take the elevator. I'm just talking for myself.
I will only have 1 cup of eggnog this holiday season, not 2. One thing that you're going to do. So as we close out here today, I want to say thank you for your interest in your health, interest in our community's health. Let's give our panelists a round of applause. They are totally awesome. If there's a way that we can serve you, please let us know. Flora, bring this thing home.
I want to extend a very, very big thank you for Greater Hamilton Chamber of Commerce. Yes, give them a hand for putting this together. We also want to thank Rotary and Kiwanis for being a part of this as well. We are extending our gratitude for the team here today. We have learned a lot, and we are so appreciative to also know that you guys are encountering and including mental health. That is so important. Important enough that I have went back to school to get my LPC because I want to be a part of the solution and not complain about the problem. So 9 months away, and then I'm going to be here to help. So we also want to remind you, the Chamber has asked that I remind you that their upcoming Chambers event, November the 21st, mark your calendars. If you have nothing else to do, please plan on coming to Mix It Up, hosted by Howard Hanna. That will be November the 21st between 2:30 and 6:30, so please plan to come. Thank you so much for coming today.